Gerry Stovin from UNISON. The first one is the revenue budget framework. UNISON wants to put on record the hard work being done by its members to continue providing Edinburgh services after years of cuts to local government. We know from the Accounts Commission report last week that the Scottish Government has cut funding to local authorities by 9.6% in real terms since 2010, which, as it says, has led to major challenges in maintaining services. But with projected cumulative cuts in Edinburgh of around 100 million in the years to come, that becomes less of a major challenge and more of a slaughter. The report was brave enough to point out that the budget cuts are having an impact on services. UNISON has long said that councillors should be saying that loud and clear, and not pretending that you can administer cuts with no effect on services. The report says what we all know, that there is already evidence that social care services are failing to keep up with demand, with elderly people facing long waits to be assessed. It singled out an example from Edinburgh. It said people waited 100 days for assessment, with 16% facing an unreasonable delay. This UNISON branch has already flagged up 7,000 hours of unmet need and 1,800 backlog of needs assessment. In health and social care, how can 1.9 million further efficiency savings and a further 7.2 million of transformation programme-related savings possibly do anything to improve this? It can only make things worse. All services are and will be forced to make huge cuts in staffing and service provision. And as per the experience of previous cuts, it will be the remaining staff who will have to bear the pain of trying to deliver vital services to the most vulnerable. Our survey of health and social care staff last year revealed a workforce that is running to stand still, feels demoralised, overworked, overpressured, unsupported and disbelieved. For them, action on workloads came higher up than anything else they wanted the union to do, even above pay. UNISON has often spoken of the silent slaughter of local services. At last, the Audit Commission report, wider reporting of UNISON's concerns and the concerns of many councillors, that silence is beginning to be broken. But we are where we are now, and staff in many areas are telling us of intolerable workloads, inflexible systems leading to complaints from the public, and of pockets of management cultures that undervalue staff and put them under unnecessary pressure. Behind every figure in this report, behind every cut or efficiency saving, there is a staff member trying to deliver a service, and often trying to explain to a member of the public why they can't respond as they'd like to. The Council cannot escape the fact that it has a duty of care to its staff, and it mustn't pretend we can provide the same service with far fewer resources. UNISON will not stand in the way of progress and development. We are not against efficiency, and very often if you engage with staff on the front line, they will tell you what the barriers are to providing a better service. But they are not taken in by the cuts dressed up as efficiency. We will highlight the risks of failed transformation programmes and be vigilant to any named scheme, be it bold transformation or the latest change project. We have shown over and over again that if these initiatives are predicated on huge financial cuts, they will not work. The Council cannot sustain any further cuts and continue to provide services on the back of already overworked and overstretched staff. UNISON will remain open to engaging with the Council on new ways of working, of trying to find better ways to provide services, but only if that is what it's genuinely about. When we start with a figure that is to be cut and all else has to follow from there, that is not innovation or new ways of working, is purely and simply a cut, and we will continue to campaign against that.